Jimmy Donaldson, aka MrBeast, one of the biggest YouTube creators in the world, recently made a video where he helped cure 1,000 blind people by partnering with C International to provide manual small incision cataract surgery. In the video, a surgeon stated that half of the 200 million blind people in the world could be cured with a simple 10-minute surgery.
Many of MrBeast's critics claim that this charitable act, as well as many of his others, are only for clout and profit. Many have mocked MrBeast for this video, but his defenders have appeared in large numbers to praise the video and MrBeast's charity. MrBeast's channel is currently the 4th most subscribed to channel on the platform.
I did not know who this person was until yesterday. I swear I had never heard of him before, but apparently my nephews are big fans and love his videos. Love his little pop-up restaurant stuff he does. I guess he does some of that.
I'm not familiar. I mean, I was introduced to him a couple of Thanksgivings ago by a 9-year-old at Thanksgiving who, the people like these, they're largely charitable content as I understand them. He does money giveaways. It's like kind of game show, gamified, but it's kind of like a play it forward ethos where obviously he makes quite a bit of money from the stream, but I think that he generates a lot of goodwill because he does end up dishing it out back out a lot. So I think part of what set people off here was that first he tweeted a tweet that kind of reflected a kind of a surprise almost that there are so many people who have curable blindness. He tweeted, "I don't understand why curable blindness is a thing. Why don't governments step in and help? Even if you're thinking purely from a financial standpoint, it's hard to see how they don't return on investment on taxes from people being able to work again." So many people picked up on this tweet as like, welcome. Are you new here? Yes. People don't have health insurance. There is a huge economic inequality in the world. This is definitely a thing. People weren't necessarily all snarky about it, but they were like, hi, welcome to capitalism. A lot of leftists were jumping on this tweet saying, yes, you're so close. You get it. Like the world is substantively unfair, which is why we needed this follow-up tweet after he started to receive some criticism in which he said, quote, Twitter, rich people should help others with their money. Me. Okay, I'll use my money to help people, and I promise to give away all my money before I die, every single penny. Twitter, MrBeast is bad. I think part of it was the perceived naivete of him talking about this issue like he's the first one to discover that there's poverty and that money can help people. Whether or not that's fair, I think that that's part of how the tone shift ended up happening. It's those two tweets together.
So I mostly missed the initial tone. When I was looking, I was mostly seeing people attacking the people who were criticizing MrBeast. So I wondered if this was one of those cases where internet is so mad about like Black Ariel, but when you look, actually it's most people mad that anyone would be mad about Black Ariel, and like 6 people actually mad about Black Ariel. So it sounds like you're saying that's not the case. There was legitimately people who were venting their frustration. But is that
it wasn't like about MrBeast per se. I mean, like no one expects whoever MrBeast is to have like a sociology degree and like he's just a guy who made it big on the internet. I don't think it didn't come across to me like people angry at him, but there is a little bit of edge to this idea that we see this with someone like Bill Gates. Bill Gates has a lot of money, comes on the scene. He says, I'm going to solve all the world's problems with my big brain and my money. And I'm going to buy all these mosquito nets, and aren't I great? And what you see is a pattern of folks who basically use philanthropy to cover for, one, either their actual bad actions, maybe you think that's the case with someone like Bill Gates, or at very least cover for the extent to which they are benefiting from a substantially unequal system. I think someone like MrBeast, look, you play YouTube right, you get a big following, he's not exploiting children in a mine somewhere. Like, of all of the ways to be very, very rich, being a YouTube celebrity is hardly the most exploitative, extractive, problematic way.
Although we would say that.
I've got a dog in this fight, I guess. But it's like writing a book. It's like it's not the worst thing you can do. It's like not people that are really hurt by this. But still, there is, I think, some skepticism, particularly on the left, that people who are doing these very ostentatious philanthropic displays aren't doing it out of the goodness of their heart. They're doing it because they don't want too much attention to be paid about like how they have so much wealth, how they have the ability single-handedly to cure blindness for hundreds of people, and what that means about the system that we live in.
I mean, at the end of the day, though, like it probably doesn't matter, or doesn't matter very much to the person whose eyes are being fixed.
Sure.
If the person gives them the money to help do it. then that person gets a lot of likes and retweets and shares, and they make more money. Like, oh, well, because they get to see now.
Well, yes and no. So I think I think that's true, but also part of this is that apparently MrBeast is not using his personal money for a lot of this, so he gets all this goodwill for giving money away when really he has these like sponsorships that pay for X, Y, and Z. Well, yes, who cares if you fundamentally get your eyesight cured, but also, why is it the case that there is money to cure people of blindness? Corporations have this many, MrBeast has this many. People have resources to do it, but are only willing to do it when they can sell a product or get ad buys on a YouTube video.
Well, but
what does that mean about society? Look, the reason this is
we
such
want
an
to harness
attractive-
the profit incentive in order to create social good, right? That's the...
The reason why this is such a compelling act is because we think of our eyesight as one of the most essential, important senses that we have, something that's so fundamental. We're all blown away by the story of Helen Keller and what she was able to overcome as kids. You know, like eyesight, it's like eyesight. And the fact that there are people who are blind, but for a very inexpensive surgery, a relatively inexpensive surgery, is really galling, morally galling for many people. And that's that you could see MrBeast reacting to that, kind of coming to that realization, like, how is it possible that we live in a world where people have curable blindness and nobody's doing this? I think that was a really sincere, like really productive observation to make.
I guess I'm missing that.
Wait, so the question is, if this is something that's so essential, why do we live in a society where everyone who has curable blindness isn't able to have their blindness cured, but for a rich benefactors and some advertising dollars stepping in to cure it?
The answer to that is obvious, because the efficient allocation of resources is complicated, right?
Well, I think the answer is obvious. It's because we decided, unlike most other peer nations, to live in a country where healthcare isn't a human right, where your ability to get healthcare is contingent on your ability to pay for it. And if you think that's right and fair, you think that's right and fair. If you think that, like MrBeast, I think is coming to the realization that it's unconscionable that one person might get to see and another person can't, simply because they couldn't come up with, what was it, like $1,000 for surgery? It wasn't even that much money in the grand scheme of things. If markets were rational, everyone would say your blindness is worth much more than $1,000. But the reality is that willingness to pay doesn't equal ability to pay. That's why economics is so
here we are using market forces to generate that money to pay for these procedures. He can make money. He can monetize his charity by making videos about it and pay for it, and then it's a win-win.
The argument is that it shouldn't come to that. The argument is that there's a systemic failure here, that he's stepping in to fill the void. It's not his fault. It's a good thing that he's stepping in to fill the void. But the question is, what does this mean about the society that we designed, where this void exists in the first place?
I mean, people aren't just like little pieces on a chessboard where you say, well, I put more of my, it's like a Catan game. I put more of my grain here and more of my wood here. Like that central coordination effort is public policy, is difficult. So we want to harness the ability, that people will seek to maximize their profits, to making more money. And if that can be set toward the task of providing social good, we want to do that.
No, Robby, the question people are raising is, why are we relying on moving around pieces on the profit Catan board instead of deciding that healthcare, your ability to see, should not be contingent on a benevolent benefactor? Healthcare is a human right. Eyesight is a human right.
But just saying it's a human right doesn't mean it gets magically provided for, right?
What it means,
a doctor has to provide it. They have to be paid.
Let me be specific.
Who's going to pay them?
We should have a universal healthcare system. We should have a single-payer healthcare system,
right, but
where the government decides to collect taxes. Right now, we're all paying premiums, right, for our health insurance. Instead of paying those premiums to a private insurance company that takes some portion of that for profit and then selectively pays for some part of the medical care that we need down the line. And by the way, if you stop paying even for a second, all of those back payments don't accrue to your benefit at all. You're just SOL. Instead of taking those premiums and paying them to a private insurance industry, we take those premiums and pay them to the government in the form of taxes. A smaller amount of premiums than what we're currently paying goes in the form of taxes, and the government uses that money to make a universal healthcare system for all of us that guarantees healthcare, guarantees a cure to blindness if it's curable blindness, no matter how much money we have, no matter if we stop paying taxes or stop paying premiums.
But it can't be guaranteed if there's a finite number of doctors to provide, like, it can't just be magically guaranteed.
Why do you
just
keep
because we
saying
do
magical
that.
as though all of our peer nations don't have some kind of universal or
I mean, many of our
national
peer
healthcare
nations
system?
have long lines for healthcare coverage.
And they don't have
They
it-
have it in
and-
Canada. A lot of people in Canada come here to get healthcare procedures they can't get there
Wealthy people in Canada.
because they'd have to wait months and months.
Wealthy people in Canada sometimes come to the United States to jump the line and not have to wait for surgeries. But there's not a Canadian you can find that, I'm sure you can find some Canadian, don't be literal, overly literal, but the overwhelming majority of Canadians wouldn't trade our healthcare system for a moment because they don't have things like incurable blindness in Canada. Because there's no situation where someone wasn't going to be able to get the healthcare that they need because it costs too much money. And in Canada,
You
people
think
aren't
Canada's
dying.
incurable?
Yes.
What do you mean? I mean, it is curable. It's not incurable. It's curable.
Curable blindness, sorry, yeah. In Canada, they're not paying a 10x markup on insulin, and people aren't dying because they're rationing their insulin because it's affordable there, because their country
They probably have
allows them to
insulin
negotiate.
alternatives there that
No,
always
it's not
bring that up.
insulin. It's the exact same drug. It's the exact same drug that costs 1/10 of the price in Canada because their pharmaceutical industry hasn't lobbied their government to prevent them from negotiating drug prices
Well, I'm
and
against
creating
all
a drug
that.
cartel. Well, right, we're in agreement. You know, we are making choices about how we structure our society and who we care about and who we want to prioritize. And look, I always say this. If you don't believe healthcare is a human right, if you believe that there should be people walking around blind because they can't come up with $1,000 or a few thousand or however much it is for the surgery, that is your right. You have to sit in that position and hold that morally, and that's your right, and I'm not going to argue with you. However, if you are shocked by that reality, the way that MrBeast seems to have been shocked by this reality, oh my God, I can radically transform all of these lives with an amount of money that actually means nothing to me. What's going on here? What does this mean about our system? I think that's an insight for which he should be lauded. But the next step is now thinking about what that means in terms of changing our public policy so that he is not in this position of having to be the national health insurance for all of these people who don't have anything to rely on.
Right, but just saying it should be a human right or something doesn't magically create the infrastructure to provide it.
Do you want to know how to create it? Because you keep saying magically, but there's many, many plans. The Bernie Health Insurance plan.
There are benefits and drawbacks to all these
the
plans.
way that it would
It's
be
much more
enacted-
complicated than you're making it
It's not
out to
that
be.
complicated. I'll explain it to you. Right now, one of the most popular programs in America is Medicare. The Bernie's plan would drop the Medicare age 10 years from 65 to 55 the first year. Exact same, and also, it's not the exact same actually. There would be additional benefits. It would include hearing, vision, and dental, and also enrich the program in some other ways that I'm forgetting right now. But the first year, 65 to 55, and I think it was also everybody under 18, so now children automatically healthcare coverage. And the next year, it's 55 to 45. The next year is 45 to 35. And after 4 years of slowly expanding Medicare, suddenly everybody in the United States of America is covered by Medicare. That's how Medicare for all could conceivably be enacted.
It'll just magically fix everything. We'll be able to treat the same number of people with the same number of doctors. We'll not have long lines and shortages.
It doesn't magically treat everything. The doctors that we have now, who are largely reimbursed by Medicare payments already, one of the changes that Bernie would make is to increase the reimbursement rate so that doctors don't have a disincentive to take Medicare and Medicaid patients, which they currently do have, and means that poor people have a lower quality of health care. However, yes, you make these kind of adjustments to the program, slowly expand Medicare.
Are we going to get more doctors to cover all these additional people?
It's the same amount of doctors we have treating everybody now. What you're basically saying is an admission that there's people who right now aren't getting treated because there's a doctor shortage. Absolutely, we need more doctors. That's why another one of Bernie's plans was to cancel student debt so that doctors who routinely graduate with close to $500,000 of debt don't feel like they have to go into plastic surgery and move to New York City or Seattle to recoup their investment. They can stay in their hometowns and communities and be family medical practitioners without feeling like they're taking a real personal hit. All of these things have to happen together if you are invested in the idea of having a society like so many of our peer nations where people get to have treatment regardless of how much money they make, regardless of if they or their husband or their dad or their mom loses a job, that they can be covered and know that if they get cancer, if they get sick, if they have a child who is born with blindness that could be cured, that they don't have to live a substandard quality of life as compared to someone who has more money.
But we absolutely want to move toward a more efficient system, and I think there are so many deficiencies in the one we have with how insurance is paid for. But you're going to want to build in profit incentives to this system.
Why?
So that because that is how you harness social good.
I don't think that healthcare should be a profit-based industry.
For the doctors, for the hospitals, I mean, everything is a profit-based industry if it's successful at all.
No, that's not true. The military isn't profit-based. It's fully socialism. You pay
and
soldiers.
And it's wildly wasteful.
It is wildly wasteful. I would argue that it's
doubly wasteful because we actually blow things up with the money we put into it. But
I would argue it's wasteful because of what we choose to do with it. But the unfortunate thing is that we use our military as a jobs guarantee, as a subsidy program to do bad things when we could be having a jobs program that keeps people at home doing socially beneficial things that actually make America a better place, like becoming doctors in the United States instead of doctors that go overseas in war zones, like becoming infrastructure, like becoming teachers.
It will cost more money to do. Like
nurses.
You can't just saying it's going to be covered this way. It doesn't mean there isn't the money to do it. You have to get more money from somewhere.
It literally costs less money.
And profits are how we create more money.
It literally costs.
Well, some of these things would save money, and I would agree with that.
Less money, like Medicare for all. Not only does it cost the government cost less money overall. Again, it's the tax money, it's the premium money.
It costs us money because we're giving too much money to the insurers right now. We don't need to do
the middleman. But additionally, small business owners, the number one expense for people who have companies is healthcare costs. No longer are employers required to provide healthcare to their employees. It's the government.
Yeah, we should
government insurance.
It's a bad system.
So, like people trying to start a business, people who want to leave their own jobs to start their own business are worried about their own healthcare coverage. Entrepreneurship will thrive. This is a win-win-win for literally everybody who's not named Pfizer or Blue Cross Blue Shield or the one with the duck.
All right, we got to leave it there.
Affleck.
Should have left it there. We'll have more Rising right after this.